Hi, my name is Randus Wallace, and today I'm going to talk to you about how to prevent yourself from getting the spread of the coronavirus, also known as COVID-19. What is the coronavirus? This small molecule can go inside your lungs, damage it, and try to kill you. By practicing safety measures, you can reduce the spread of COVID-19. My mother is a registered nurse at a hospital in Maryland, and she has witnessed 3 people die of COVID-19. I am very concerned about the outbreak of this illness. Living in the DMV, you are at risk of getting COVID-19. The coronavirus comes from a family of viruses that can cause illnesses such as the common cold, pneumonia, Middle East respiratory syndrome, and severe acute respiratory syndrome. Its symptoms include fever, muscle body aches, shortness of breath, difficulty breathing, which can lead to kidney failure or death. Today I'm going to discuss how to protect yourself and others from getting COVID-19 by practicing social distancing, proper hand hygiene, and covering your mouth correctly when you cough. You are at risk of getting COVID-19 by not practicing social distancing. Social distancing is also called physical distancing, and physical distancing is keeping yourself 6 feet away from the other person. By not going to large groups or gatherings or crowded places. According to CDC, COVID-19 spreads mainly among people who are in close contact 6 feet for a long period. Spread happens when an affected person coughs, sneezes, or talks, and droplets from the mouth or nose are launched into the air and land into the mouths of noses of people. The virus can be transmitted by coughing or sneezing or touching contaminated objects. According to Johns Hopkins University and Medicine Coronavirus Resource Center, as of April 6, 2020, there are 1,341,907 confirmed cases of COVID-19 worldwide. Of these cases, 74,475 people have died, and 253,657 people have recovered, and the numbers are still climbing. According to CDC, avoiding space between you and the others is one of the best tools that we have of stopping the spread of the coronavirus. Spread happens when an infected person coughs, sneezes, or talks into droplets into the air, affect another person. Recent studies have shown that people who are infected with COVID-19 but do not show symptoms also play a role in spreading the disease of COVID-19. Proper hand hygiene can reduce the spread of the coronavirus. According to the World Health Organization, you should always regularly wash your hands thoroughly with using alcohol-based rub or using soap and water. According to WebMD, washing your hands for a minimum of 20 seconds can kill off the germs of the coronavirus using soap and water. Hands should be washed before, during, or after food preparation, before eating, before, after treating somebody who is sick, before or after treating a cut or open wound, after going to the bathroom, after changing diapers or helping a child in the bathroom, after blowing your nose, coughing, or sneezing, after touching an animal or touching pet food or pet waste, after handling pet food or pet treats, after touching garbage. Another way to reduce the spread of COVID-19 is to cover your mouth when you cough or sneeze. According to NBC News, infectious disease experts maintain most of COVID-19 cases spread through close contact with the infected person. Individuals are being exposed to droplets from a sick person's sneeze or cough. These droplets can travel as far as 6 feet outside that zone. The risk is much lower. Dr. William Schaffner, a professor at Vanderbilt University, who is medical director of the National Foundation in Infectious Diseases, calls the 6B area that is exposed to droplets the breathing zone. Individuals who breathe in what that person has breathed out in the breathing zone will be exposed to air that contains some virus. According to CDC, to help stop the spread of the germs, you need to cover your mouth and nose with a tissue when you sneeze or cough. Put your used tissue in the wastebasket. Wash your hands immediately. If a tissue is unavailable, cough or sneeze into your upper sleeve and not your hands. In conclusion, we now know that there are safety measures that we can take to prevent the coronavirus. Social distancing, frequent hand hygiene, and covering your mouth correctly when you cough. If you follow these safety measures, you and your loved ones can reduce risk against the coronavirus.